rolling into the meeting. Give it about another 30 seconds so we can keep admitting our committee members, and then I'm going to kick it off. All right. Well, welcome to the cross-sector task force to address overdose joint meeting of the Advisory Committee for Resilient Nevada and the Substance Use Response Working Group. It is 3 p.m. on September 13th, and I will call this meeting to order, and we will get a roll call done by our state support team to establish quorum. Garrett, can you help us by kicking off to determine if we have quorum and get a roll call?
Yes, good morning or good afternoon. Senator Fabian Dunyate. Attorney General Aaron Ford. Senator Heidi Sievert Ganzert. Assemblywoman Claire Thomas. Assemblywoman Melissa Hardy. Dr. Stephanie Woodard. Jessica Johnson.
Present.
Lisa Lee. Shayla Holmes.
Present.
Dr. Leslie Dixon. Christine Payson. Debbie Nadler.
Present.
Jeffrey Iverson. Eric Schoen. Chelsea Cheatham. Steve Shell. Angela Nichols. Jessica Barlow. David Sanchez.
Present.
Brittany Collins Jefferson. Lilnetra Grady. Ryan Gustafson. Dr. Farzad Kamyar.
Present.
Marissa Lober.
Present.
Catherine Loudon. Dr. Carla Wagner. Elise Monroy Marsala,
Present.
Darcy Patterson,
Present.
Pauline Sala, Ariana Saunders, Cornelius Sheehan, Jamie Ross,
Present.
Malika Toston,
Present.
Quinny Winbush,
Chair, this is Dawn Yohey for the record. Just for the record, Chelsea Cheatham as well as Lainey Grady do appear to be on.
Thank you, Don. Thank you, Garrett. With the two folks that just entered, I believe we should be pretty close to quorum. But I'll give you a second to get that count figured out and get back to us.
Chair Christine Payson also just arrived.
Okay. Thank you. As long as we can get those folks counted as part of attendance, and Garrett, you can make a note of that. I appreciate it. Going to move this meeting forward into public or agenda item number 2, public comment number 1. Public comment will be taken during this agenda item regarding any item appearing on the agenda. To provide public comment telephonically, dial 775-321-6111. When prompted to provide the meeting ID, enter 614-523-966#. In consideration of others who may wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. No action may be taken on a matter discussed under this item until the matter is included on an agenda as an item on which action may be taken. And it looks like or do we have anybody available or interested in public comment? And
Chair, this is Dawn. You actually do not have quorum yet,
okay.
so we need to pause for a second.
Okay. I believe without quorum, we'll need to verify with the deputy AGs if we can still continue with the informational items on the agenda. Do we have someone from the AG's office on that can help us clarify?
You do. It will not be a meeting, so you just state that. And basically it'll just be informational discussion, but you wouldn't need the agenda and it would not be a meeting. And you wouldn't need minutes, so.
Okay. Thank you, Henna. As our state team continues to tally the folks that are joining and entering the meeting, we will take a second before we move to find out if somebody's available for public comment number 1. And for those of you that are in attendance today, just want to say thank you. We appreciate your time and effort to make it today and show up and be part of this group.
For the record, Brittany Collins Jefferson is here.
Thank you, Don. So I think we're at a point where the state staff team in support has, oh, I need one more confirmation. We have a person who joined by phone, who is a member of Surge or ACRN. Whoever joined
Oh,
by
thank you.
phone, can you let us know who you are?
So let me, trying to multitask. Let's see. So we have this program, it's called the felony arrest notification. And I do apologize.
No problem. You're entering as part of public comment, not as one of the members of the committee members, correct? Oh, I see they muted you. So thank you. It looks like change your name also. So thank you. I'll call on you in just 1 second. Okay. So are we clear, state team, that we do not have quorum and we're going to move forward as an informational air quotes meeting?
Can we get confirmation on who called in at 702-759-8070?
See if I cannot unmute them. Can you do me a favor, Garrett, and unmute the 702-759-8070 so we can determine if they're a committee member or a person interested in providing public comment. Looks on my end like they're public comment vote, but I'm not sure.
That
Chair
person-
Leslie Dixon has arrived for the record.
Thank you, Don.
And I'm Catherine Loudon. I don't know how close you are to having quorum.
Thank you, Catherine. We're I believe the number was 2 away, so I think we're 1 away right now. And then we're looking for confirmation for the person who called in from the cell phone or phone number from 702. Christine Payson has her hand up.
Chair, you have quorum.
Okay. Awesome. We're going to move forward then. Christine, give me a moment to work through the agenda and I will get you our state staff to unmute you and we'll get to you. So I'm going to go ahead and read that agenda item number 2, public comment number 1 more time. And then we'll see if we have anybody available for public comment now that we have confirmed we have quorum and this meeting will move forward. Public comment will be taken during this agenda item regarding any item appearing on the agenda. To provide public comment, telephonically dial 775-321-6111. And when prompted to provide the meeting ID, enter 614-523-966#. And in consideration of others who may wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. No action may be taken on a matter discussed under this item until the matter is included on an agenda as an item on which action may be taken. Do we have anybody available or interested in public comment number 1? Oh, okay, we got Debbie Nadler and Jamie Ross. I wasn't sure who came up first. Either one of you, can you unmute yourselves and speak to public comment number 1, please?
Debbie Nadler for the record. Whoops. I had told Garrett prior to the meeting that I have a doctor's appointment at 4:40 and I have a feeling we're going to run late today because due to time, people logging on and everything. And I just want to make sure I'm not going to mess up our quorum if I leave at 4:40. So I don't know if that's public comment or I'm just letting y'all know.
Awesome. Thank you, Debbie. I'll keep it in mind and have the state team watch with me. I appreciate you. Jamie Ross.
Thank you.
Thank you.
Thank you, Chair. This is a public comment based on a public comment made at the Sept Advisory Board meeting this morning. There was a board member, Jolene DeLune, who was asking about the incubator grant, which I believe was funded with these funds. And she was wondering, there were supposed to be 5 grant awards and who had received those awards. So it was just a question posed at the Sept Advisory Board meeting, and there wasn't anyone on that meeting to ask that question. And as the co-chair, I am bringing it forward as a public comment on this board and hopeful that that information can be shared publicly at some point in time. Thank you.
Awesome. Thank you, Jamie, for bringing that forward. Not sure if it is this fund or not, but we will get a response to members in email or to you directly in email from the state staff that kind of explains it, if that works. Anyone else available or interested in public comment number 1?
Apologies, Chair. I just got a text message from Christine Payson. She's having trouble unmuting, but that phone number that you were seeing is Christine. So just FYI.
Oh, awesome. Thank you for feeding us that information. We were trying to fix that. Garrett sent to me that if you need to unmute via phone, you can press *6 and it will unmute you. Garrett, do you see anybody that I'm missing for public comment number 1, or do we look all clear?
I think we are all good.
That's what I see also. Thank you. All right, at this time, we'll move to agenda item number 3, which is welcome and informational with a review of the objective for the cross-sector task force to address overdoses. So I gave a little welcome at the beginning of the meeting. And again, I just want to thank you for those of you that could show up today and be part, please be part of this meeting. As a reminder, let me give it a second. There we go. As a reminder, this task force was created by joining the Attorney General's Substance Use Response Working Group, or the SURGE, and the Advisory Committee for Resilient Nevada, the ACRN, in order to determine necessary action to reduce the risk of overdose in Nevada's communities, to prepare responses for the state and local jurisdictions in the event an increase in overdoses occurs, and to provide technical assistance, guidance, and resources to rapidly implement best practices to reduce risk for overdose and enhance the capacity to respond to events. And should such overdose events occur. This task force does not have statutory authority to direct funding. However, we have been created in order to provide guidance to the department in order to take action quickly and in order to reduce the risk of overdoses in Nevada communities. That being said, it's very similar to the roles that the SURGE and the ACRN play in creating the response to the opioid epidemic and guiding the funds from the Fund for Resilient Nevada to respond and support communities that are struggling with overdose and opioid uses. That being said, we'll make recommendations, and the state team will put together a plan, present the plan, and then push forward the plan into action into communities. Do we have anybody from either on this task force that has a question or comment or anything to say as we move forward through the agenda? All right. Looks quiet for now. So again, the Attorney General Aaron Ford is the chair of the Surge Committee, and I, David Sanchez, am the chair of the Advisory Committee for Resilient Nevada. And today we are going to get some information from Elise and go over a review of recommendations that we talked about in our last meeting. At this time, I'd like to move forward in the agenda to agenda item number 4. Agenda item number 4, we have review and approve the minutes from our August 23rd, 2023 cross-sector task force meeting. Those meeting minutes went out as quickly as possible by our state team. I hope you all got a chance to review them. Do we have anybody that is interested in making a motion to approve the minutes, or any questions, clarifications needed on the minutes from our last meeting?
Debbie Nadler, for the record, I vote to go ahead and approve the minutes.
Thank you, Debbie. Can I get a second?
This is Carissa Loper. I will second approving the minutes as written.
Thank you, Carissa. At this time, we'll take a vote to approve the meeting minutes from our last time together. Can I get an aye from all that are in favor of approving the minutes as written from our last meeting?
Aye.
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 Are there any nays that are opposed to approving the minutes from our last meeting? And do we have any abstentions? All right, that sounds to me like the meeting minutes from our last meeting on the 23rd are approved. And we will now move forward in the agenda to agenda item number 5, which is Nevada Opioid Communication Assessment Presentation for information and discussion. Elise Monroy Marcella will be bringing this to us. Elise?
Thank you, Chair. Hello, Cross-Sector Task Force. I'm happy to have the opportunity to present today. I put a couple slides together just to help share the information that I have. So I just need 30 seconds to get that pulled up and squared away. Okay. Let me make sure I can see my notes now. I have entirely too many screens open. Okay, so I took the opportunity after the last meeting where we had some really great conversation about the need to expend funds that have been allocated to this committee, like Chair Sanchez said, and there was a lot of interest during the conversation about a messaging campaign. While I have recently left the OD2A grant, I had the opportunity while I was there to work on a really innovative project that I wanted to share with you all. So I'm going to walk through that. First, before I start, like you, I am a volunteer on this committee. In my day job, I think it's important that I tell you that I work with a firm called Bells and Case Government Affairs. I'm the government affairs manager, and we represent a number of clients on a contract basis. Some of our clients are included on this list: the Public Health Association, the Primary Care Association, Psychiatric Association, and Shatterproof. But if you're interested in looking at the full list of clients that we represent, you can go to bellscase.com/clients. But I'm here today speaking on my own behalf as a volunteer like the rest of you. Okay, so my objectives today, again, to share information about the work that I did under the OD2A grant, and in hopes that the committee would consider doing a project like this as part of a messaging campaign funded by the Cross-Sector Task Force. So I'm going to go over the key findings from the communications assessment, discuss our methodology for developing our campaign, and then I'm going to talk about lessons learned and our challenges. And specifically, I'm going to talk about the mistakes that I made because there were some significant mistakes on this this campaign, but it, you know, again, lessons learned. So if this project is done again, it could be done even better. Okay, so in 2021, the OD2A grant did a communications assessment where we looked at CDC funded messages over the last number of years about our CDC funded opioid campaigns specifically. I think there were 6 or 7 that we looked at. We might have also done a review of some of the SOR funded material. We did focus groups. We did an assessment on kind of paid placement. And what we found through, and I will send a copy of the report to the committee so everybody has it. But some of the key findings that we pulled out of that report was that the messages that we had, you know, used our CDC resources to fund had pretty poor visibility, a lot of overnight placement on TV and radio. The focus groups that we had done from a pretty diverse range of people had actually never seen anything that was developed. And we did focus groups that ranged from college kids to older in English and Spanish, had never seen the messages. And then the other feedback that we got was that the messages that were developed were sterile and clinical and not relatable. So of course, after we had this communications assessment for our year 4, we wanted to take a stab at kind of doing some messaging in a different way to specifically address these issues. Poor visibility, poor placements, sterile messaging, overly clinical, not relatable. So in order to identify our target audience, we looked at our suitors data. Suitors data is put out essentially twice a year, and this is the state unintentional drug overdose repository system. We looked at the 2021 data report to tell us who was most at risk of dying by unintentional drug overdose, and we found that that population at the time was men between 18 and 64-ish, 55-ish, and men in Clark County specifically. So this is what we use to inform our target audience. So we worked through our granting process, and we took the information that we gleaned from the communications assessment and then our suitors data, and we utilized a vendor through a master service agreement as part of our grant to develop a social media messaging campaign. We worked with a vendor to develop messaging goals and targets. And we decided that we were going to do an influencer campaign. So we would partner with influencers to deliver harm reduction messaging. Our plan would have 2 components, organic reach and paid reach. Organic reach would be, we would identify an influencers whose target audience kind of met our target that we were trying to reach, and they would post on their own account. And then we would do a paid reach, which would be tied to an actual business account. At the time, we had planned on tying it to the department's account. Our budget was just over $27,000. Okay, so the messages that we decided to deliver was an evidence-based harm reduction messaging. So we pulled from SAMHSA, national harm reduction organizations, to inform the script that we would give the influencers. We used evidence-based messaging with the exception of, oh, I have a big spelling error on there, sorry. With the exception of one thing, I opted to change the script to encourage people to call 911 and tell them that they're with someone that is unconscious as opposed to overdosed. We're hearing and have heard for years that there are some communities where there's concerns that police are arresting people that may be covered under the Good Samaritan law, and calling 911 and telling someone that you've overdosed ensures a police response, whereas telling someone that they're unconscious will get an EMS response. We also know that most EMS and first responder agencies are administering naloxone to any person that is unconscious. So I felt like this was an appropriate change in messaging, but it was a pretty big deviation in terms of what is considered evidence-based. Okay, so the influencers that we worked with, we found 3 influencers. Chantal Danielle is a content creator in Las Vegas whose target audience matched who we were trying to target. She creates spicy content on Instagram and other platforms. And then we found Coco Montrese, who is a pretty famous drag queen. She's in Las Vegas, and they create content for, again, the target demographic we were looking at. And then we identified one more influencer, Max Crosby from the Raiders, who we filmed messages for, but the campaign was pulled before we were able to place his ad. So I have the messages here to show. They're each a minute long. I'm going to play them at 1.75 speed, just to make sure we can get through them. I'm almost done. So I'll start with Chantal Danielle, and I'm going to turn up my speaker here.
Elise, we're not able to hear anything.
You can't hear anything? Oh no, I tried this last night. Let me put this closer. Okay, give me a thumbs up if you can hear it. Oh no. Okay, I tried it last night. And I'm bummed, but I will send I'll send the videos. I'm going to let them play just so you can see them. The message that she's delivering is essentially be safe if you're going to use, test your supplies, don't use alone, call 911. But I'll let this play just so you can see it. Okay, again, I'm so sorry there's no audio. I tested this last night and I'm so bummed you can't hear it. But I'm going to play Coco Montrese's now, which has some graphics. Okay, and she ended there with, remember, it's not about what you do, it's how you do it. Okay. Oh, so let me go ahead and click through to the next one if I can figure it out. Okay, all right. So again, I'm so sorry there was an audio. I did test it last night. I'm so disappointed. But here is just some of the output that we got. So this was, again, just organic placement. So both of those posts together ran for a week. I think they ran for a week. It could have been 4 days, 4 or 5 days, but it was pretty impressive numbers, as you can see here, over 140,000 total engagements, lots of plays, lots of shares, lots of comments. The comment analysis was pretty positive, people sharing their stories of recovery and even their best practices for harm reduction when they're using. And then there was some question about, like, why are we sharing this message? Like, why do we need to tell these people to be safe? And we worked with the influencer to respond in their comments and say this is a PSA from people that needed it. People that need the information. Here's an example of the comments. And as you can see here, the engagement. If you have looked at any other public health kind of social media campaign, these kind of numbers are not common on public health PSA social media messaging. So this really, people engaged with this in a way they don't usually do. So our successes and best practices. So utilizing a master service agreement vendor helped to speed up the process. Utilizing data to inform our target population was possible and it was easy. Using the suitors data, there's also other non-fatal EMS data we could have used. Using relatable messengers and relatable message was successful. And using harm reduction messaging was received relatively positively. when we showed these messages to the CDC, to our funder, I was frankly like a little terrified at the thought of that. I thought I was going to get like axed. But the feedback that we got from the CDC on doing something innovative and edgy was incredibly positive. They said the best content they had seen that year. They appreciated that it was a message that was evidence-based, impactful, and brought with levity and humor. That's not something you see. Additional feedback we got from our vendor, from the master service agreement vendor, KPS3. This was the most successful public health PSA campaign they had ever run, and we had to end it early. So these numbers were only part of the campaign. But the reason that we had to end it early was important, and we will get into those challenges and lessons learned. So the first challenge that we had with taking this strategy was finding people to speak on harm reduction and safe use is very hard. I think there's a lot of stigma around use, and that's fair and understandable. But I think it's easier to find people that will message about recovery and even an abstinence approach. But finding people to talk about safe use is challenging. So when we got to the campaign, again, we had that two-part approach with organic reach and paid reach. We had to pull the campaign before we got to the paid reach piece. We had planned to do paid reach through the DHHS account. So the messages that you saw would have appeared as DHHS paid advertising. And, you know, without getting into like the nitty gritty of why it was pulled, I'll tell you that, and I'm going to read exactly what I wrote yesterday. Without getting into the nitty gritty of why the campaign was pulled, I'm going to take full responsibility as the program manager at the time for putting DHHS in a really hard spot with the campaign. I engaged with agency communications staff and got the go-ahead and all the approvals I needed, but something like this that is edgy and intended to push the envelope should have had engagement from higher leadership, and I put the agency in a really hard spot because we didn't engage agency leadership. So they were surprised by the ads, and again, 100% on me. That shouldn't have happened. So we should have engaged somebody higher from the beginning. So because we didn't do that, we had to pull the campaign early, but I'm still considering it a success because we had amazing organic reach, and we reached people that probably wouldn't have had a harm reduction messaging delivered to them. So my last slide, I've been talking a lot longer than I intended. I apologize. It's mainly because I'm nervous. So my wrap up and my recommendation would be to utilize influencers as part of a messaging campaign. This only needs to be a component of a larger, maybe more traditional messaging campaign. A campaign should be driven by data and target those most at risk, and utilizing an MSA vendor is the best way to go to expedite the process. Not only does that expedite from a contractual standpoint for the state, a lot of these vendors like KPS3, they already have relationships with influencers and agencies, so it makes it go that much faster. And then finally, an organic reach campaign is probably enough. There's likely no need to do a paid advertisement campaign. So again, I talked a lot longer than I had intended to. This was the most exciting thing that I did last year. It was really cool to get to do something different, to push the envelope a little bit, frankly. And it was just a really exciting thing to do. So with that, are there any questions? Debbie Nadler, hi.
Hi, I think that's fantastic. And I love that you spoke out, thought outside the box. It's terrific, the initiative and everything. I had an idea about this. I don't know if anybody watches Scotland and the UK. Their overdose rates are dropping, and they're pushing hard with campaigns across the country over there. And they have so many out of the box messages that they're doing. It's incredible. But one thing another state is doing just to add to this, where we really don't have to pay influencers, a lot of people are using their local policemen, dressed really hip, but they're policemen, and they're making everybody feel safe in the messaging. When they hear from a policeman that you're not going to be arrested, it kind of encourages them, hey, here's a policeman telling me I need to call. And if we have some kind of messaging like they had in the drinking days, not that nobody's not drinking, but friends don't let friends drive drunk. God, it's been so long, I don't remember, but something like friends don't let friends use drugs alone, or friends don't let friends use drugs and die, just some kind of messaging like that. If we get one message across and really hit it home. And then the last thing, and I'm sorry I'm talking so much, but this is great what you've done. Another thing, which would kind of be a dual combination thing, is to have a contest in schools, maybe high school kids do videos and of why you shouldn't use drugs alone, or the dangers of drugs, or which gets them active, which gets them doing research on what drugs can do, and have a contest in the schools, and the winner's video goes live, on messaging. And that way we get prevention in there, education, harm reduction, and kind of everything, if that makes sense at all. Just thoughts I've had on that. But thank you, Elise, for doing that.
Awesome. Thank you. I think that it's a really good idea. I know there have been throughout the years a lot of campaigns that have engaged youth in schools. I think that's a really good idea and probably should be part of a bigger campaign. This should just be like, if we're going to take like a 5-prong approach, let's say, that's probably a lot for messaging, but like 3-prong, like maybe influencer or social media messaging is just one piece of it. And then I do just feel compelled to respond a little bit to the police piece. First, I have to say there are a lot of people, especially in this space, that don't feel safe hearing from police. They just don't. And I think that a harm reduction message, which is, if you're going to use an illicit substance, these are the things you need to do to be safe, is hard for a police officer to deliver. I also think that there are, and I know that there are other subcommittees working on this, but we have to figure out what's happening with the Good Samaritan law. I have heard that there are police that are arresting people in violation of the law. And I had it put best to me from when I was on the OD2A grant by one of our peers. The police are going to arrest you regardless of what the law is. So you, as someone who's using drugs, need to know what the law is, which puts a lot on people who could be potentially in chaotic drug use. So but I do think there's a role for police messaging to a certain population, but I do think that a harm reduction message has to be a component. Harm reduction is an evidence-based strategy that pulled this country out of the HIV epidemic, and it's going to be what pulls us out of this. We have to acknowledge that use is happening, and just because people are using doesn't mean they should die. And there's evidence-based strategies to help facilitate that, not being safe and reducing harm. So I appreciate the opportunity for, maybe folks to think about something like this as part of a campaign. Yes, Debbie.
I'm sorry, I forgot the other thing, and I get what you're saying about the police. Another thing that a lot of people are doing is they're involving family members, like brothers, sisters, siblings, younger kids who have lost their sibling to an overdose, and they get on and they talk, because right now we are losing kids age 12, 13, 14. So I know the age of the overdose a couple years ago was males, 70%, ages 18 through, like you said, 45. Well, it was 18 through 45 a couple years ago. But now, I mean, look what's happening, not only in our state, but throughout the country. We've got 12, 13, 14-year-olds, and we have got to, pinch in on that age group as well. And I think grieving family members would be an asset, in promoting harm reduction. unfortunately, we have lived experience in the loss and the suffering, and we'll do anything we can to prevent it.
Thank you for that. Brittany, did you have a question for me or for the chair?
No, I had a question for you. So what age demographic, when you guys did the research for this campaign, was it reaching the younger, like the youth and the young adults, or was it reaching more of an older population? Do you know?
So I didn't get, because I left the program before the full evaluation came back, I didn't get the demographic breakdown. But I can absolutely reach out to the folks that have the evaluation report and bring that back.
Okay.
But we
I think
did
that
look,
would be.
I mean, I'm so sorry. I'll just say we
No,
did
go ahead.
target people that had an audience demographic of that kind of, males 18. I think we asked 18 to 45 was what we looked at. So they looked for influencers who had audience makeups of that demographic. But the what we weren't expecting, what I wasn't expecting, was the amount of shares that we got. So it was shared, I think, 1,000 times, 1,500 times. So that means someone in their audience saw the video and then shared it. I know we know how social media works, but like what we don't capture is the demographic of those shares.
Got you. Okay. I was just wondering, because I know that I feel like drug use is becoming more accessible for our youth. And so I was just wondering if it was reaching that, that demographic.
All right. Any other questions or comments for Elise before we move forward? Looks like I don't see anyone. But thank you, Elise. Very informative, and you didn't go long at all, in my opinion. You did just right. So thank you for taking the time to put that together and to bring it forward to this group.
Also, I'm sorry, I will send you
Please.
guys, I'll send to state staff the links to the Google Drive that has the videos so you can watch them. Again, I'm so bummed because I tested it last night and it worked. But I'll make sure that those get shared so you guys can watch them and listen to them.
Awesome. Thank you, Elise. All right. Debbie, do you still have your hand up, or is that a new hand up?
I'm sorry I hit it by accident.
No worries. Just wanted to make sure it didn't miss you. Okay. At this time, let's move forward with the meeting to agenda item number 6, which is a review of recommendations for the public messaging campaigns. In this agenda item, we wanted to be able to have a conversation on the type of campaign that would be needed. Are we still thinking the Good Samaritan law? Elise mentioned that some folks are working on that currently. What is the target population that this committee would like to move forward as a recommendation to the state? What would messaging look like to make a difference? And is this more than one campaign needed at this time? Elise also brought that forward as far as like a 3-pronged approach or more than 3-pronged approach. So at this time, I'd like to hear from committee members as far as what their thoughts are. Again, we've heard a couple of comments in response to Elise's presentation, so we could avoid repetition as much as possible, but I do want to kind of be able to get a consensus or a line to go down as far as what it is this task force is thinking would be helpful at this time. Anybody have comment, concern, clarification? I have Debbie.
Yes, Debbie Nadler for the record. As far as the public messaging campaigns, I think maybe, and I love what Elise did, but maybe if we do have different levels of it, maybe different age groups, divide it among different age groups. Because obviously a 12, 13, 14-year-old is not going to be doing what an 18, 19, 20, 21-year-old is. Maybe do it by age group. I'm just thinking out loud here. But obviously all ages are important, but there's going to be different messages for different people.
Right. Thank you, Debbie. I agree. And I think that speaks to the, more than one campaign needed at this time. When we look at specifically the outbreaks that we've had of overdoses in Nevada recently, what would those targets look like as far as this committee is concerned? Jessica?
Yeah, hi everyone, Jessica Johnson for the record. I really appreciate the opportunity to have this discussion. I just acknowledge that I myself am not a media expert, so I don't know if it would be helpful to learn a little bit more around best practices. I think my recommendation would be for any public messaging campaign to be data driven. So working with the information that's available and to decide whether it's important for the messaging to be universal, meaning to a large, broad audience, or to be more targeted, as in the example that Elise presented today that used data to inform a very specific, very targeted message to a particular group of individuals. I'm peripherally aware of some of the other campaigns that are happening here in Clark County that have a different message for different types of audiences. So I just wanted to raise this as an important factor as this group thinks through whether this would be a broad sort of public messaging campaign or a more targeted campaign. Either way, I recommend that it be informed by data, depending on how that's decided. Thank you.
Absolutely. Thank you, Jessica. And those are good points. From my point of view, kind of looking at what we have seen in the state as far as public messaging goes that is geared towards a harm reduction approach. I think that we have an opportunity to look at what has been used recently, and being that we have committee members who have had some experience with this, I think that that can go a long way towards guiding what it is we'll be looking towards. But I agree, you're absolutely right on data-informed decisions is also important from my perspective as well. Do we have anybody else that's wants to join the conversation? Shayla. Oh, I thought I had Shayla, but then I don't have. Oh,
I am
again.
trying to speak. I'm so sorry, Chair. I struggle with Teams, so I didn't realize I was taking it down or that it had made it up.
No worries, no problem at all.
Nonetheless, Shayla Holmes for the record. I appreciate what Elise has brought forward, and I also appreciate Ms. Johnson's comments. I would like to, while I don't have data available to inform the data-informed decision-making, it's tough to not agree with that. I do think anecdotally from my experience with attempting to market in the rurals and also seeing Elise's campaign, like I saw your campaign and didn't realize it was your campaign. And I had people going, oh my gosh, Shayla, have you seen this? And I went, no, but that's brilliant. So it was exciting to see that. But I also heard the negative side of that, in that I am in a very rural community, and that did not speak directly to the individuals who are misusing substances here, right? They saw the campaign, but they didn't hear the message. They saw the extreme of it, and that was the focus, because it's not what they see here. That's not their people, so to speak, right, as a whole. So I think having those targeted messages to those targeted populations is so important, because there were certainly some individuals that live out here in rural Nevada that saw that and it did speak to them. And so I think that it's important that we have a variety. And I do think I've worked with KPS3 in the past, not to say that that's who this group would want to utilize, but they have a really brilliant way of having the same message in a different context. So like we have uniformed language with different influencers, or we have the same slogan, like Debbie threw out some pretty good ones. But with different images that speak to different targets. So it can be uniform, but be different. So it can appeal to a variety of different populations. I mean, we just had 2 overdoses out here in Fernley within the last couple of days, and one individual who overdosed twice in the same day. So we definitely have a need for it, but I think that we do struggle with the Good Samaritan, and we do struggle with folks fully buying into that. And I think we do have a lot of work to do on that before we, I think, fully invest on a public messaging campaign around Good Samaritan, because I think it needs to be something we can fully stand behind before we really push that out, because I'd hate for us to push that out and lose trust from this audience as a whole.
Awesome. Thank you, Shayla, for your comments and bringing that forward. It makes good sense, your comments. So thank you for bringing that. I have Elise and then Jamie Ross.
Thank you, Chair. So I will say, Shayla, I felt kind of like a heel for not realizing like what a lightning rod drag queens were nationally politically, and I think that was part of the issue. So yeah, I just wanted to say that. I know that's not something that resonated. So I have a process question, Chair. So is our goal today, because I know we're coming up on an hour, is our goal today to be able to direct agency staff to say, this is what we want to do, this is who we want to target, and this is what we want the message to be? And then, because I know funding's been allocated, and I'm eager to, again, get money moving, because it's been a year since, I think it's been about a year. So a process question, is our goal today to direct staff to do X, Y, and Z?
Yes, that's what it is. And I know that we're coming up on an hour also, but I think that it's important that we take the time to have the conversation and to get feedback from committee members to be able to give guidance towards what the dollars are going to be spent towards. Does that make, I think I said that right.
Yes. Okay. Thank you.
Jamie Ross.
Thank you so much, Jamie Ross, for the record. And my question is, what sort of public messaging campaign is this? Is this a harm reduction message for people who are currently using drugs? Is this what in my field we call a primary prevention message for people who are not using drugs to discourage them from using drugs? Is this a message to public health and public safety individuals? I'm not quite sure who the target audience is, this public messaging campaign. And from a prevention perspective, I would want to make sure, especially when we're talking about primary substance use prevention, as Alyssa O'Hare, who is the preeminent expert on primary prevention in the state of Nevada, likes to say, bad prevention is worse than no prevention. And if we're going to be doing messaging campaigns for people who don't use drugs, I really don't want to make the mistake of making more kids more likely to use drugs because we're using the wrong messaging. Thank you.
Thank you for that. It adds to what it is we're trying to do here, and I appreciate that. Krista Loper.
Thank you, Chair. In response to that, I think it's so from my perspective, I think it's mostly supposed to be a harm reduction campaign and maybe secondarily a primary prevention campaign, just because what this task force was brought together to do was reduce overdoses, which means that people are in general probably actively using. That's just my assumption. Could be overdoses of people who have never used, not really sure. But if it is primarily a harm reduction campaign, I do think honing in on those target populations would be valuable, including, right, at least like a rural spokesperson who could speak to that, as well as folks that would still speak to our urban, like Las Vegas users on the Strip, or maybe more urban Washoe County users. But maybe we have like 5 different sort of messages running across social media that are speaking to each of those groups. I'll just throw that idea out there.
Thanks, Carissa. What are your guys' thoughts on the ideas that were brought forward so far? Debbie, go ahead. You have the floor.
Thank you, Debbie Nadler, for the record. Yes, this is harm reduction, but prevention is part of harm reduction, because you're preventing people from using who can overdose. And the problem we have today is we have the 11, 12, 13, 14-year-olds reaching out to try a drug for the first time, and they have no clue. We've got fentanyl, nitazene, xylazine. We have so many drugs pouring into our state that these kids know nothing about. They have no clue that if you do one pill, it can kill. One line, you won't be fine. I mean, I could go on and on. I think it's kind of a co-adhesive type of target when you're talking about PSAs and harm reduction. I think it encompasses both those who are using and those who are thinking about using, those who are suffering and maybe, okay, you know what, or those who go to a party. Hey, I'll just take one pill. I mean, we've got to get all of them and dividing it up. And I like what was said about in the rural communities, using kind of some cohesive message, but changing who's speaking to go to who's listening would be a good way to do it too. Just my thoughts here.
Awesome. Thank you, Debbie. Do you have anybody else who would like to jump in? Brittany
David, this is
Collins Jefferson.
yeah. This is
Please.
Brittany Collins, for the record. So I really liked, I think it was Debbie's recommendation when she said trying to get the schools or the youth to do like a competition for a campaign. And I think that can be something done like with the health classes. If you reach out to the schools and see what schools want to participate. And it also gives the students an opportunity to learn in the process of putting the campaign together. And then they'll also reach individuals that look like them, right? Their peers. They'll be reaching their peers in the process at the same time. And so I'm really interested in targeting the younger populations, because I also agree that it's becoming more accessible and they're having more interest in trying things that maybe our generations weren't as open to as young as these children are. So I would like to see us targeting the middle schoolers, high schoolers, young adults going into college. So.
Awesome. Thank you, Brittany. I have Catherine Loudon. Catherine, it looked like your hand went down. That mean, okay, I'll take that as you're not interested in speaking, and then I will call on Jessica Johnson. Catherine, if you do want to speak, please put your hand back up so I can call on you. But Jessica, the floor is yours.
Thank you, Chair. Jessica Johnson for the record. I just wanted to echo some of the previous comments, and I think if the goal for this agenda item is to provide some direction for staff and how to move forward with this, I do think that it will be important to work with folks who are experts in crafting and creating these types of campaigns. For example, having a determined message that's informed by where the audience is at, and specifically, I know youth have been mentioned by a few different committee members, and just being really intentional to Ms. Ross's earlier point around identifying specifically what the goal is of the campaign, who the intended audience is of the campaign, and how that message might need to be different for different audiences. Sounds like there's some consensus around a tailored media campaign for specific audiences. I just would really like for us to consider that be data informed. For example, peer-to-peer messages for specifically youth and young persons around prevention has not been an evidence-based strategy that's been recommended in the past. I'm happy to follow up with staff on some of those recommended messages. I just think that it's important to work with experts around this type of messaging so that we're getting it right. Thank you.
Thank you, Jessica. And again, considering data-driven messaging and how this group wants to push things forward, I'm not sure what this committee is thinking as far as what we're going to end with today for recommendations or something that we can push forward to have looked into. But it seems like the things that are leading the way are a multifaceted approach for messaging, and also that the importance of data being part of the driving factor of that. I have another. I thought I saw someone's hand up, but maybe not.
Hi, yes, mine is up. I'm sorry,
Thank
I couldn't unmute my microphone before and get my camera on. I really love Brittany's idea. I think working with youth is always a good idea if youth help create. And I think we can give them guidelines that are research-based and proven effective methods. Things like social norming, as well as perhaps norming things like being prepared, having naloxone, being trained in naloxone as a community, making sure that there's social norming around the use, and then also their ideas about how to make it safer overall for everyone. I think when we involve them, then we really do have a broad impact on our whole community, because it is happening in our schools. There is experimentation, exploring, and there are overdoses. And I know it's not the biggest group, but I think if you're going to change a community, it's always a good idea to include the youth in that change.
Awesome. Thank you, Catherine. It definitely seems like this committee is interested in looking at what it would take to target or have youth included in the target population for this messaging. So it's good that we're getting some kind of direction, and I think where we are at next is looking at what does how can data help drive what that looks like moving forward. Elise?
Thank you, Chair. So, I think there's a couple places that we can pull from data. So to help inform the target population. So the SUITRS data, which is the State Unintentional Drug Overdose reporting system. So that's out. It's on the OD2A page for 2022. That tells us just at a high level, died by unintentional drug overdose last year were between the ages of 35 and 40. But there's some other data in here about county, jurisdictions being affected, substances. So I think that I think there's data available. I know that there's also monthly data reports that are put out, at least there were under the OD2A grant. So I think that there's data that we could pull from. I think that using evidence-based strategies for messaging is something that I think is a little more elusive. I don't know that there's a repository or a bank or I know Jessica Johnson has reports, but that would be one thing. And then just for the group's knowledge, I've been taking notes and I think I'll be able to craft a motion. So whenever you guys are ready, let me know. I'm taking notes. I think I have a potential motion for us. So just so you know.
Awesome. You're a rock star. Thank you. Debbie?
Chairman, Chairman.
Yeah.
Hi.
Henna.
These are just only for information discussion, all the items.
Right.
So there's no possible action for these items. So
Right.
no motions.
Right. Which leaves us at the end of this conversation. Dawn will kind of give us a review of what the next steps are going to be, but not that the notes are not needed, Elise, because I think some summary of what it is that this group has put together, and I know the state team will be looking at the all of this as they put together the minutes, but so that we're all on the same page when we leave. That's definitely what I'm looking at.
I'm so sorry. I appreciate that. I thought the purpose of today's meeting was to allocate funds, given the last meeting that we had. We had discussed not being able to make a motion because it wasn't agendized. So I'm so sorry, but my reaction is to be a little frustrated. I'm sorry. I thought the purpose of today was to get money moving, and so that's unfortunate. But happy to, again, I'm taking notes, happy to wrap up at the end whenever you guys, if that would be helpful to the group.
For sure. And Elise, I'm with you. And I think the way that I'm taking it is that we're providing guidance for the spending. So we're not saying it's up to us to make a motion and determine and declare this will be spent towards X, Y, and Z. But what it is saying, as the task force, we have identified public messaging as our interest and, an accurate way to direct funding. And our recommendation or our, what's that called? What the group thinks as a whole is that this public messaging will be what is needed, and we recommend that the funds be used to create this public messaging campaign. And then the state team will say, as per the task force, we're going to attack putting together a public messaging campaign, and this is what the members of the task force thought was important. And then they're going to piece it together, parse it together, and then say, hey, task force, this is what we made. What do you think? Any additions or, any changes? What do you guys think about this? This is what we took from you guys, and this is what we're putting together and planning on putting out there. And then we will see that happen. So I see what you're saying, Elise, as far as the frustration and confusion as it comes to making motions, approving and voting on an action plan. But I think we swipe all that away, give our subject matter expertise, what we know about what has worked and what hasn't worked, and then having the comments and insight that Jessica and one of our other committee members brought forward about the need of importance to have, Jamie Ross brought it, to have data to back what it is we're asking that we push forward, and the experience that you're bringing with previous public messaging campaigns will help the state craft what it is we're looking for. Sorry, that was so long-winded. Debbie.
Thank you, Debbie Nadler for the record. There is another data survey that's been done through the University of Nevada in Reno. It's the Nevada Youth Risk Behavior Survey. And if anybody cares to look at it, it's under scholarworks.unr.edu. And if you look at the surveys, and thank you, Jessica Johnson, for the information today, but it's done every other year. So it's being done in 2023 of this year. But in 2021, if you look at the reports, we've got a lot of kids using drugs. They were honest. So maybe that's some data that we could use, perhaps. It's in the schools throughout the state, but it's, you know, a variety of them. It's not every school, I don't think.
Right. Okay. Thank you, Debbie. And I think that it's good that you brought that up to all of us here as committee members and the public, so that we can have that included in the minutes and something that it will be able to be looked over and reviewed if anybody on the committee or anybody in the public wants to access that information. Once the state team puts together the minutes from this meeting, we will have easier access to pulling up that information and going over it. So before we lose quorum, and because some people have to get off the line, we're going to move on to the next agenda item. The discussion has been good, and I think there needs to be more of it, and we will have an opportunity to help guide and shape what this public messaging campaign is going to look like. I'm excited that we got to a point that we came to a consensus or an agreement that this is what we should be and what we'd like to see move forward. Now we'll have to bear with the state as they put together what this public messaging campaign is going to look like. And we will have a voice to say, that doesn't seem like it's what it is, like what we were talking about and what we were looking towards, and what can we do to make it different, or can we add this, take away this type of thing. So that being said, I do not see, oh, I have Shayla. After Shayla, I'm going to wrap it up
I'm
and
so
pass it
sorry,
to the
Chair.
next. You're good.
I'm just curious. So maybe I missed something. I had to transfer from a computer to a phone. Are we providing any direction or input at this time in regards to what type of public messaging, like topic, subject matter, or are we just going with broad public messaging and then waiting for the state to come back with some groundwork based on data? I feel like we're being very vague, and I mean, maybe the state would prefer us to be very vague, or should we be giving some additional direction, or did I miss something?
No, that's a perfect point and great question. So basically there's 20 something of us here that are part of the task force. If every one of us would speak loudly to what we think would be important to have as part of the public messaging campaign as subject matter experts, the state would have a better direction to go from. So what they have heard from us so far is, as you're saying, a broad messaging or specifically targeted towards youth, right? We've heard youth over and over and over again. As we've heard that, and as we've heard the counter responses to youth, I think what we'll see the state do is look at data, look at best practices, and then we will have them bring something forward. They will craft from what this discussion looks like and what future discussions look like. So if there's something that you'd like to see this public messaging guided towards, I need you to say it now. Shayla.
Okay, saying it now, Chair, thank you. For the record, I would like to also see a campaign targeted towards our rural communities and intervention resources. And I think, I mean, prevention is also important, but I think intervention resources and our rural communities really should have some consideration.
Awesome. Thank you, Shayla. Debbie.
And obviously the preventative end of it with our youth, a lot of our youth, but perhaps if we come up with 4 or 5 suggestions, so they have something to look at, is that something we can vote on? And maybe we give the state a, 1, 2, 3, 4, and 5. And then that way they'll know what we all think is important, what we want them to look at. Maybe we could do that.
So I don't know necessarily that we'll be voting on something like that, but what I would ask everybody in attendance, and for those of you that view the minutes later, please email the state team with the direction that you'd like to see the public messaging campaign targeted towards, and anything that you don't want to be left out of that. And then again, that'll help them craft, and that'll help us guide what that campaign will look like. Elise?
Thank you. So I would like to see a messaging campaign that is a harm reduction message that targets people in active drug use that are actively using.
Absolutely. And to me, that seems like the target thing here. So they brought this task force together because we're seeing a rash of overdoses in different communities. And then how do we respond to them? This task force, in order to expedite some type of plan, came up with public messaging, which circles right back around to folks that are overdosing currently, or as close to real time as possible. And how do we get messaging to them that is based on a harm reduction approach, and also in prevention saves lives. Shayla? Maybe not Shayla. Oh, nope. Yep. Your hands down now. It might be a technical difficulty, so I'll give you a second. If it's not, whenever you're ready, we're ready for you. I think too, it's important to bring up that maybe we can have the state team send out a survey. We sent out a survey previously to get some feedback from committee members in the same manner to help guide and direct what X, Y, and Z would look like. So I think what we'll do is we'll ask the state team to put together a survey that will help those that answer give some feedback and direction towards guiding the creation of this public messaging campaign. Looks like Shayla's hand is still down, and I did not see her unmute, so I will continue moving forward. Time is always an issue in these meetings, so I'm going to move us forward. And I don't want any of the committee members to think that this has been a waste of time or that we're spinning in circles, because we gained some real good traction last meeting. If we just take out the idea of it's specifically us spending the money to, we are specifically guiding the spending of the money. And we're still on track and still on point with a faster version of response by creating this public messaging around opioid use and overdose. We are doing some good and we're getting some things done. What I would ask is, again, as much as possible, communicate to the state team where it is you see that this public messaging would be most effective and who it is that needs to hear this public messaging. And from there, we'll see what comes up. I don't see anybody else with their hand up or interested in commenting. I'm going to move forward on the agenda to agenda item number 7, which is Don Yohey bringing forward a review for the next steps for the department and the discussion of this work group. Don?
Yes, good afternoon, Chair and members of the committee. My name is Don Yohey, for the record. So what we'll do from this point on is the department's going to take everything that was mentioned in all of the earlier agenda items. We're gonna, and what we've heard is this is a harm reduction campaign. What we want is some data informed, or we need some data to inform our direction, potentially working with experts around this type of messaging. Different age groups are targeted. Learn a little more about best practices, using data to drive the messaging, uniform language with different images that speak to different targeted populations, potentially a youth contest, something research-based, social norming, really being prepared, having naloxone available as a community, how to make it safer for everyone, rural communities and intervention resources, as well as potential messaging campaign that is harm reduction that targets people in active drug use that are actively using. And so we're going to take all of this information. We invite a few of you to be with us while we're on this journey to develop this messaging campaign. We're going to reach out to a few vendors on our master service agreement because that is the fastest way to get bids. We will get bids on some of these potential campaigns. Also bring that back to you guys. Potentially, we can go ahead and send out a survey if that is still the direction that this team wants to go through. But we will also be just sharing the process throughout as we move forward and develop all of this. So just wanted to kind of wrap that up and make sure we captured everything.
Thank you, Dawn. Do we have any questions or comments for Dawn after that? It makes good sense to me, and I believe the plan is to, or you know, in order to not get into a mess with the open meeting law, they'll have one person from, I don't know, I'm sorry if you already said this, but one person from the surge and one person from the ACRN to help guide what this will look like. Debbie?
John, thank you very much. Everything you said was perfect. And I still like the idea of a survey from us if everybody's up for it. That's just my thoughts. Sorry. Thank you.
Thank you, Debbie. Yeah, we'll have the state team work on that and get that out as soon as they can. And again, really, the issue that we've had with that in the past is not enough participation from committee members. So if you do see the survey come to you, please take some time to give us your best and thoughts on how that would
right now.
be helpful. Sorry about that. The technology. The other computer thinks I'm speaking to it. Sorry about that. Dawn, do you have anything else for us here on this agenda item?
No, we just thank you for all of your time and all of the guidance that you were able to provide us. I think this gives us a good starting point to move forward. So at least I don't want you to feel like we're still stuck just kind of spinning our wheels. We are going to be moving forward with getting bids for potential campaigns.
Awesome. Thank you, Dawn. All right, at this time, I'm going to move us to public agenda item number 8, public comment number 2. Public comment will be taken during this agenda item. To provide public comment telephonically, dial 775-3216-111. And when prompted to provide the meeting ID, enter 614-523-966#. And in consideration of others who may also wish to provide public comment, please avoid repetition and limit your comments to no more than 3 minutes. No action may be taken on a matter discussed under this item until the matter is included on an agenda as an item on which action may be taken. Is there anybody available or interested in public comment number 2? Garrett, do you see anybody on your end?
I do not.
All right, I'm going to move to last call for public comment number 2. I don't want to leave anybody out who's got anything to say or add to this meeting as part of public comment. Now is your time to speak. And again, please let us know if there's something or someone that wants to jump in with something for public comment number 2. I'm looking through. I don't see anybody. All right, we're going to move to agenda item number 9, which is the adjournment of this meeting. Again, thank you, committee members and public, for showing up for this meeting and giving us your insight and participation. We appreciate your time and effort, and thank you for coming to this meeting. Have a good day.
Thank you. Bye.
Meeting's adjourned. Bye.
Thank you.